Clinical mastitis in cattle. Occurrence, around 20% of all mastitis cases are clinical. It usually happens after birth, when E. coli gets into the mammary gland, when there's low levels of lactoferrin. It also happens at drying off, when Staphylococcus and Streptococcus get into the mammary gland, and this happens when there's high levels of lactoferrin. Causes are ascending infection from the teat canal, due to injury, or it can be hematogenous as well. In the environment, we have Streptococcus uberis, E. coli, Klebsiella, and yeast and moles. The yeast such as Candida and moles such as Cryptococcus. Also contagious infections such as Staphylococcus aureus, Streptococcus agalactiae, and Mycoplasma species, as well as Corynneum bacterium bovis. The top three in Hungary are central nervous system, Streptococcus uberis, and E. coli. So for the clinical signs and diagnosis, firstly with milk. There'll be a loss of function, so there'll be decreased milk quality and decreased milk quantity. And in the udder, there'll be local signs. There'll be redness, as well as swelling, pain, and heat. And in the cow, there will be systemic signs, such as fever, anorexia, and endotoxemia and shock. For peracute mastitis, this is caused by E. coli. We can see milk clotting, a swollen mammary gland, as well as fever, and they can die within a few hours. In acute mastitis, there will be milk clotting and a swollen mammary gland as well, but there will be no systemic signs. And in subacute mastitis, this is caused by Staphylococcus. There will be milk clotting, but the mammary gland will be normal and there will be no systemic signs. And in chronic mastitis, this is also caused by Staphylococcus. There will be milk clotting, but there will also be mammary gland fibrosis and no systemic signs. Additional tools we can see for mastitis are bacterial culture and antibiotic tests. We can also have the bulk tank test for Staphylococcus aureus and Streptococcus agalacticae, as well as using a standard plate count. Or we can do an individual test on the farm, and we can do a PCR for mycoplasma. And for the treatment, milk these cows separately. If there's a peracute infection, do not use antibiotics. Give fluids and flunixin megalamine as well as calcium, and make sure to milk them. If there's an acute infection, give antibiotics intravenously or antibiotics intramuscularly, and give fluids as well as flunixin megalamine. Intravenous antibiotics are fluocinolones as well as potentiated SAs and tetracyclines. For gram-positive bacteria, we use benzyl penicillin P as well as cloxin as well as cephalexin and cefepime. For gram-negative bacteria, we use cephalexin as well as kanamycin as well as amoxicillin clavulanic acid, along with cefoperazone and cefquinone. So for treating mastitis in an acute, subacute, or chronic, we do an antibiotics through an intramammary infusion. The antibiotics are the best choice according to the susceptibility test. Treat for 3 days and then reevaluate, and do not treat for more than 7 days.